Hi all, welcome to Raaonline. Today we are going to deal with one important clinical pathology that might have a catastrophic event in the perioperative period, that is mediastinal mass. Here suddenly you may not be able to ventilate the patient, or you might have a great vessel obstruction and you may not be able to do anything. It is going to be really an anesthesiologist's nightmare if these things happen in the perioperative period. Mediastinal mass are a heterogenic group of disorder. Mostly they are benign but can be really malignant. This patient may come for diagnostic procedure for biopsy or a therapeutic removal of the mediastinal mass. The symptom can range from patient being totally asymptomatic to having severe symptom of cough and stridor. As I said earlier, it can have major airway and vascular compression which can get aggravated during your anesthesia. So, these are all the various challenges you face with mediastinal mass. Coming to the history, the first surgical removal of mediastinal mass was done by Herbert Milton in Cairo, Egypt way back in 1897. What is the surgical significance of this removal? Because this was the first case where the mass was removed through a median thoracic incision. Actually, this incision paved the way for most of the thoracic surgery, including heart and lung at a later stage. So, mediastinal mass removal was a precursor for cardiothoracic surgery. Coming to the anatomy, the mediastinum is divided into superior and inferior mediastinum. This inferior mediastinum is again divided into three parts. The division between superior and inferior mediastinum is from a line from the first rib from the sternomandibular junction to the disc between T4 and T5. This is a line which divides superior and inferior mediastinum. And this inferior mediastinum is divided into anterior mediastinum, middle mediastinum and the posterior mediastinum. Usually, some books never mention about superior mediastinum. It is actually anterosuperior mediastinum. How this anterior, middle and posterior divided? It is by imaginary line. If you take the lateral chest X-ray, the anterior and the middle compartment is divided by an imaginary line from the anterior to trachea posterior to the inferior vena cava. This is a line which separates the anterior and middle compartment. And the middle and the posterior is divided by an imaginary line just 1 centimeter posterior to the anterior border of the vertebral bodies. These are all imaginary line. So, what are the anatomical borders of this three division? Anteriorly, for the anterior mediastinum, it is a sternum, and posteriorly, it is the anterior aspect of trachea and posterior margin of the heart. For the middle mediastinum, what is posterior for anterior will become anterior for middle mediastinum, and the posterior part, as I said earlier, a vertical line drawn along thoracic vertebra 1 centimeter behind the anterior margin, and posterior again. What is posterior for middle mediastinum becomes anterior for posterior mediastinum, and posteriorly it is costovertebral junction. Why you have to know about this three divisions although there is no tissue plane separating it? Because each mediastinum has some particular arteries, veins, organs and everything, so that location will help us to decide on the surgical as well as the anesthesia management. So, this is the content, and you have the superior mediastinum where you have the upper part of the thymus. Phrenic nerve comes from the superior mediastinum and goes into the middle mediastinum. Your vagus nerve comes from the superior mediastinum and goes into the posterior mediastinum. And you have the trachea, lower part of esophagus, aortic arch in the superior mediastinum. Coming to the anterior mediastinum, you have the lower part of the thymus, and the middle mediastinum, you have the heart, and the posterior mediastinum, you have vagus nerve, recurrent laryngeal nerve, the lower part of the esophagus, and the descending thoracic aorta. These are all the various important structures which lies in the mediastinum. To summarize, in the superior mediastinum, we have organs including thymus, trachea, esophagus and thoracic duct. Arteries, you have the aortic arch, brachiocephalic trunk, left common carotid and left subclavian artery. Coming to venous system, you have the superior vena cava, brachiocephalic vein and thoracic duct. And nerves, you have vagus nerve, left recurrent laryngeal nerve, cardiac nerve and the phrenic nerve. Coming to the anterior mediastinum, organ is only going to be thymus, artery, smaller vessels, vein again smaller vessels, smaller lymphatics and nerve, nothing is there. In the middle mediastinum, you have the heart and the pericardium. From the artery side, you have the ascending aorta, pulmonary arteries, pericardiophrenec artery and vein. From the venous side, you have the superior vena cava, azygous vein, pulmonary vein, pericardiophrenec artery and vein. And the nervous system, you have the phrenic nerve. Coming to the posterior part, the organ is going to be esophagus. Major blood vessels includes thoracic aorta and thoracic duct. And vein, you have the azygous, hemiazygous and thoracic duct. And nerve, you have the vagus nerve.